Feliz Viernes! Hoy es Viernes! I'm Rory Foster. Actually, it's not Viernes. It's Thursday. I'm pre-recording this lesson because headed to the mountains with my oldest, Caleb. He's 13, so we're going to see if we can get him in a 30-yard range so he can take a shot at a bull elk this weekend. Anyway, okay, back to Espanol. Hoy es Viernes, and I'm glad you're here with me. Today we're looking at a topic. This is a student-requested topic. Examen de hombro en español, doing a shoulder exam for like a painful shoulder in Spanish. And this is one of those topics that actually means something to me. Last year in November, I dislocated my right shoulder crossing this boulder field. I fell and went to brace myself, and I felt it pop out, and then it popped back in. And that whole weekend actually, it's still not better. Later when we do some exercises, you'll see my limited rango de movimiento. Anyway, just like usual, we're going to dive in and help you with completing this shoulder exam in Spanish. So let's see if we can get started with some vocabulario. Anatomía, first of all, el brazo. Later we'll see right and left, but brazo derecho, brazo izquierdo. And el dorso de la mano. There's one, I forget the name of the test. There's one test, the back of your hand, where you put that on your waist and then extend back out. Dorso de la mano, back of the hand. El hombro, shoulder, el hombro. Now, hombro is a tricky one. It's easy to get confused with a couple of other things, and don't worry about it. If you haven't made this mistake yet, you will. It's super common. So we have el hombro is not the same as el hombro is not the same as el hombre. El hombre is man. And so you will definitely talk about your patient's man at some point on accident. But another word that's also a little tricky is hambre. Hambre is hunger, and so it's what we use with the expression tener, to have hunger, to be hungry, basically. And casi son las 12, and so yo tengo poquito hambre. But we're not talking about hambre, we're not talking about hombre, we're talking about el hombro. See? The shoulder. Hombro, what's right again? Hombro derecho, hombro izquierdo. Okay, continuamos. El húmero. El húmero is the bone, the humerus, ¿verdad? El húmero. Y ahora tenemos el manguito rotador, the rotator cuff. Manguito rotador. And tenemos el músculo, in general, muscle, músculo. Y tenemos el omóplato, scapula. So el omóplato, it's a kind of an odd word, but that's scapula. And sometimes you might have to tell someone to, touch the other one. So el omóplato. La articulación, or la coyuntura. You can see articulation in that word. So that's a joint. Coyuntura is also joint, articulación. Now, I'm not talking about the Colorado kind of joint here. I live in this world. I'm not a part of it, but I live in it. So this is articulación. Anatomía is our category. Okay, bien, anatomía. Articulación, coyuntura. You could use either. If articulation is easier for you to remember, stick with that one. Okay, continuamos. La articulación esfera-cavidad. Esfera-cavidad, ball joint, ball socket joint. So if you were to describe the shoulder, maybe you would call it a ball socket, maybe you wouldn't, maybe that's your hip. Again, this is where I get a little out of my league because I'm not a provider like you are. Okay, bien, continuamos. La cintura. La cintura is everything waistline and lower back. And so here is the cinturón, your cinturón, belt. And so everything relating to the belt, just think of that. El cinturón is everything that relates to la cintura. El cinturón is belt. Okay? Bien, so la cintura. La clavícula, clavicle. Y los ligamentos, ligaments. Y los músculos, muscles. We had el músculo before, a little bit of repetition never hurts. Los tendones, tendons. Y ahora, signos y síntomas. You're going to laugh at this first one, but I promise you that people use it this way. Signos and síntomas. We have el chasquido. El chasquido is a clicking, or you might even hear el clic, or tiene un clic cuando mueve el hombro, un clic. El dolor, hinchazón, swelling. And the next one you're going to want to know about for sure, rango de movimiento. Rango de movimiento limitado or menos rango de movimiento, range of motion, rango de movimiento. And I think I've got a torn rotator cuff from years and years ago, and then this recent dislocation. Yo tengo menos rango de movimiento en el hombro derecho que tengo en el hombro izquierdo. El hombro izquierdo tengo más rango de movimiento. El hombro derecho tengo menos rango de movimiento. Y tengo chasquido right there. Click. All right, bien. La debilidad, weakness. Debilidad, weakness. Está débil is another way to talk about debilidad. Debilidad tiene debilidad. Está débil is weak. All right. La rigidez, rigidity, stiffness, rigidez. Pinzamiento. I had to look this one up. Pinzamiento, impingement. If you need to look up words, I suggest using word reference. And there are medical forums that you can dive into within word reference that really give you professional translators' takes on the best term or phrasing for something. That's where I found pensamiento. Some translators were going back and forth. So if you're looking for a good dictionary, way better than Google Translate, because word reference gives you context and you have access to these forums. So word reference.com. Wordreference.com is a great resource for you. You can access it from your computer. There's a free app on your phone, whether you've got Android or Apple phone. Okay, bien. Vamos a continuar con verbos. A few verbos to talk about or to use as you're giving exams, asking people to do certain things, etc. So, continue with vocabulario, verbos. Desgarrar or desgarrado. This is desgarrar, the verb to tear, and desgarrado would then be the adjective torn, and we'll have another one as well. Dislocarse or luxarse, this is to dislocate, obviously. And encogerse los hombros, shrug your shoulders. Encogerse los hombros, maybe you would ask a patient to do that in a shoulder exam. Estirar is to stretch. Estirar, okay? Extender is to extend, extender, bien? Y intentar is to try. Tratar is another verb that in some contexts, tratar is fine for try, but it's also the verb to treat. And so maybe in your healthcare context, you might want to stick with intentar for to try and tratar for to treat, okay? Like los medicamentos tratan, or los antibióticos tratan las infecciones, right? Tratar. Levantar, to raise, okay? Resistir, resist. You'll be asking people to resist pressure, etc. So resistir would be your verbo for that. Romper is our other verb to tear. So romper is to break with soft tissue things. And so romper, roto, is the adjective broken. So está roto, está desgarrado, both is torn, right? Are torn. And then romper, desgarrar as the verbs to to tear. Romper can also be to break for hard tissue things like bones and things like that. Could be the verb to break. But for soft tissue, muscles, ligaments, tendons, etc., romper can also mean to tear. Muy bien. Rotar, rotate. Okay, continuamos with otro vocabulario, just a little random. Así is a word that you need to have bookmarked and ready to use all the time. What it's perfect for is when you lack the words to say this and or to say that. You see my limited rango de movimiento, and you want to be able to show your patient what to do and just say así, like this or like so. And so you can say something like levante la mano y baje la detrás de la cabeza así. Okay? Para tocar what was scapula again? El otro omóplato. Okay? Bien, so así would be anything that you just aren't sure how to explain to your patient and you want them to just kind of do like you do. Haga así. Do like this. Okay? Bien. Derecho, izquierdo. We talked about right and left a little bit. So, el hombro derecho, el hombro izquierdo. This has nothing to do with me. It has to do with the body part we're talking about. El ojo derecho, el ojo izquierdo. But now this is la oreja. So, la oreja derecha, la oreja izquierda. Okay? Bien. Hacia arriba, upward. Hacia means toward up, upward. Y hacia atrás, backward, toward the back. Hacia el lado, to the side, or afuera, if you're like pushing it out. Afuera is technically outside, but hacia afuera or hacia el lado, to the side. La presión, pressure. Y ¿qué más aquí? All right, so now we've got some good vocabulario. We're going to dive into some common preguntas para el examen. Okay? So, algunas preguntas. ¿Cuál es la mano fuerte? Which is your strong hand? ¿Cuál es la mano fuerte? ¿Es diestro? Are you right-handed? ¿Es diestro? ¿O es zurdo? Are you left-handed? So, of course, diestra for a woman, zurda for a woman. Yo soy diestro. Mi hijo Caleb es zurdo. It's a problem for bow hunting. He had to have his own special bow. Nothing we can pass down to any of the girls or anything. He's got to have his left-handed bow. Okay, bien. I know. Serious problems in the foster house. All right. El dolor del hombro impide o limita sus actividades normales en el trabajo. So, does the pain in your shoulder impede or limit your activities, your normal activities? And you can give some context. En el trabajo, en casa, etc. Okay? Bien. Tiene dolor. Do you have pain, right? Tiene dolor. Tiene inestabilidad, instability. Tiene rigidez. What was rigidez again? Stiffness. Hinchazón, swelling. Pérdida de rango de movimiento. Pérdida de, you can use as an expression. Pérdida de as loss of for anything. So tiene pérdida de rango de movimiento. In other contexts, you would talk about pérdida de peso, which I could use a little bit. Muy bien. Okay. Se bloquea. Is it locking? Se bloquea. Se atrapa. Is it catching? Now, you probably know the difference between these, but I certainly don't, and I have no idea if your patients do, whether something's blocking or catching. And so as you're talking about these, you're going to want to think through how are you going to explain what you mean by blocking and catching, okay? El dolor corre por algún lado. Does the pain run or shoot in any direction? And as thank you to American family physicians and the chance to read up a little bit on these exams, apparently shooting pain al cuello o al codo may rule out a shoulder injury and maybe some sort of cervical, spinal, or disc problem. Okay, bien. So we've got some questions. Now we're getting into the exam itself. So, instrucciones para el examen. Now remember, always with our instrucciones, we're going to use usted commands. And how do you give those usted commands? You first go to the yo form of the present tense, drop the yo, add the opposite ending. So let's use the verb resistir, the verb to resist, and go through the process of making a command out of it. So here we go, resistir, resistir. We go to the yo, resisto. We drop the o, and now we have resist, right? We just dropped the o. And now we add the opposite ending. Now it's an IR verb, and the opposite ending is then going to be an A. And if it were an AR verb, the opposite ending would be an E. That's just the way it goes. So here are the opposite endings. AR verbs take an E, and ER and IR verbs get an A. So that's the opposite ending for you to form your usted commands. And now, it's an IR verb, so we're going to add the A. So our command is resista. Resista. So resista presión. Okay, resista presión. Tell me if this hurts. Okay, decir, tell me. Decirme, tell me, right? Decirme is our verb. What's nice about this three-step process is that it accounts for irregular verbs. So, decir is irregular. The yo form is digo. Digo. So we're going to drop the o, and then we'll add the opposite ending. It is an IR verb, so dígame si tiene dolor, or dígame cuando le duele. Okay? Great. So, instructions for the exam. Levante la mano derecha o izquierda. Levante la mano derecha. Now, levante, this is the verb levantar, AR verb, so it got a E on it, ¿verdad? Levante la mano, bájela detrás de la cabeza y para tocar el omóplato. See, I can't do it. Para tocar el omóplato. Levante la mano izquierda, bájela detrás de la cabeza para tocar el omóplato. Ok, bien. Rango de movimiento limitado. Ahora, desde abajo, now from below, intente tocar el otro omóplato. I need some ayuda. Even with ayuda, I can't do it. Bien. Y levante los dos brazos adelante con los pulgares para abajo. And now resista mi presión. So maybe you would be applying pressure and resistir. Actually, doctor, yo tengo dolor. Pero en este no tengo dolor. Ok. Bien. No me deje bajar las manos. Don't let me lower your hands. Or resista mi presión. Maybe that's good enough. All right. Ahora, con los brazos a su lado, en un ángulo de 90 grados. Now, maybe you have a hard time explaining this. And so, ahora, con sus brazos así. Remember, así, like this, or like so. Con sus brazos así. Rote las manos para afuera. Contra, against mi presión. Rote las manos para afuera. Ok, bien. Y ahora, con el dorso de la mano en la cintura, remember cintura, lower back, así, extienda la mano para atrás. Ok, rango de movimiento limitado. Okay, well, there are plenty of other different shoulder tests and things like that, but with this vocabulary, you should be able to piece together what you want them to do with both your verbs and your body parts, anatomy, etc., and some of those other prepositions, behind, up, below, out, etc. Bien, before we finish, let's take a look at a few common images that might be a part of doing a shoulder exam as well. Okay, rayos X or radiografía, X-ray, right? Rayos X or radiografía, TAC, is tomografía. The A is axial, if I'm not mistaken. So tomografía axial computarizada, TAC, CT scan, right? IRM, imágenes por resonancia magnética. Now, for TAC and IRM, here's my thought on using those acronyms for this. If your hospital or your system does not have sort of patient navigation signs that are bilingual, if you start talking about the IRM, they're going to have no idea what to look for because all they see is signage that is MRI. Does that make sense? And so if your system does not have bilingual signage such that you could actually use IRM or use TAC and they can see it as they're walking down the hall, maybe it's not a good idea. Maybe you just say un scan CT or CT or un MRI so that as your patient, it's not Spanish, of course, but you're helping your patient navigate your environment, your system, okay? Keep that in mind. You can disagree with me if you want, but I think that's maybe a good approach. Okay, so a few frases. Vamos, related to these images, vamos a hacerle una radiografía para ver el hombro mejor, para ver si hay fractura en el húmero o fractura en la clavícula. Vamos a hacerle un rayos X or radiografía. Quisiera pedir, I would like to order or ask for, quisiera pedir un TAC para ver el hombro mejor. I'd like to order a CT scan to see the shoulder, ¿verdad? Okay, quisiera, I would like to. That is the conditional. No, it's past subjunctive. It's a really nice, I would like to do something, quisiera. All right, now a couple simple frases for diagnosis. Artritis es una posible diagnosis. El hombro de nadador, there's a handful of expressions to talk about a torn rotator cuff. So, swimmer's shoulder, tennis shoulder, hombro del boxeador, boxer's shoulder. All of those relate to manguito rotador del hombro, right? That's the rotator cuff, manguito, cuff, which is the same word you'd use for like a mango or a manguito para taking blood pressure, el manguito, okay? Bien, manguito rotador del hombro desgarrado. Remember, desgarrado is the adjective torn. Okay, bien. And músculo roto or músculo desgarrado, so a torn muscle, ¿verdad? Hombro dislocado. See, or what was the other word? You remember it? Luxar, so that would be luxado, hombro luxado. All right, well, hopefully this is some helpful vocabulary and frases for you. Muchas gracias for joining me today, and keep up the good work using your medical Spanish responsibly, building your vocabulary. I am glad to be here with you, helping you along your medical Spanish journey. All right, don't forget to also send me your topics. If you'd like me to look at something, this was a student community requested topic. Hasta luego! Hey, thank you for joining me today on this video Viernes lesson. I wanted to invite you to join our community if you're not a member of the Facebook group already that I deliver these live lessons in on most every Friday. And also point you to the website where you can find a bunch more information about medical Spanish, whether that be courses or free materials for you or finding a private tutor to work with you online or face-to-face. And also let you know about some amazing Spanish immersion programs, either you as a medical person or your significant other as working in some other industry, or your family. If you want to improve your Spanish and you have time and budget to go do some travel, our programs are pretty amazing. I think it'd be fun to work with you. And finally, if you have some document work at your clinic or at your hospital or within your setting that needs to be professionally translated, shoot me a message, upload your document to us, and we can get you a quick quote and help you out with your Spanish language documents as well. Have a great day.